here's something that really makes you think. Despite all the buzz around hyperbaric medicine, using pressurized oxygen to help treat all sorts of conditions, it's actually not a full-fledged, universally recognized medical specialty.
Yeah, you'd think it would be, wouldn't you, with all the potential?
Exactly.
And what's fascinating here, I think, is how we often just hear oxygen therapy and kind of lump hyperbaric medicine in with that.
Mm.
But it's really a far cry from simply administering oxygen.
Right.
We're talking about a really comprehensive approach to patient care, specifically for conditions that, well, that can be improved by hyperbaric oxygenation, HBO.
And that involves specialized equipment, right? Those big chambers.
Yes, absolutely. Those impressive hyperbaric chambers and a deep level of understanding that goes way beyond just standard oxygen administration in a hospital setting.
It's definitely not just someone with a nasal cannula. HBO demands these chambers and a whole different ballgame of training and expertise to use it effectively and crucially, safely.
And if we connect this to the bigger picture for you, the sources we've looked into really shed light on the current state of hyperbaric medicine. Things like the necessary training, how it's actually practiced today, and the sort of ongoing journey it's on to gain broader acceptance.
So our mission in this deep dive is really to understand precisely where hyperbaric medicine stands as a distinct specialty and what it truly takes for a medical professional to get skilled in this area.
Yeah, what does that path look like?
And it's quite telling, isn't it, that while you won't find professors in the U.S. whose sole focus is hyperbaric medicine, other countries, I think Russia, Japan, China were mentioned, they seem to give it a more significant academic standing.
That's right, yeah. Create a recognition there.
Okay, so let's really get into the nuts and bolts. Where did hyperbaric medicine even come from? What are its roots?
Well, historically, hyperbaric medicine has very strong ties to diving medicine, which is interesting because diving medicine itself isn't recognized as a full medical specialty either.
Oh, really? That's interesting.
Yeah, though it plays a vital role, of course. The American Medical Association, they do recognize Undersea and hyperbaric medicine as a subspecialty.
A subspecialty, okay.
But that's only for physicians who are already board certified in another primary field.
That makes sense when you think about the history, with significant naval operations, the rise of recreational diving and all the offshore oil and gas work.
Mm-hmm.
There was a clear and pressing need to understand and treat medical issues related to being underwater.
Absolutely.
And it feels like a natural progression that this led to exploring hyperbaric oxygen for things like decompression sickness, right? The bends.
Precisely. And what's fascinating here is just the sheer variety of backgrounds of physicians currently involved in hyperbaric medicine. They come from so many primary specialties: internal medicine, general surgery, anesthesia, emergency medicine. The list just goes on.
So their initial training might not have had any direct connection to their current interest in hyperbaric medicine.
Exactly. Their passion for HBO might have come later.
It's almost like they've discovered this area later in their careers. And that brings up a really interesting point from our sources. The potential drawbacks of locating hyperbaric facilities within existing hospital departments that might not even be, closely related.
Yeah, that raises an important question about efficiency, doesn't it?
Yeah.
How well are these resources being used, and how easily can patients actually access them?
Right.
If a hyperbaric chamber, for example, is under the control of, say, a surgical department, the demand from just that one specialty might not be enough to keep the facility running optimally.
Plus, maybe doctors in other departments might be less likely to refer their patients to a service housed within a totally different specialty.
That's a real possibility. You can imagine a department wanting to keep its resources for its own patients, or perhaps just not fully grasping how HBO could benefit patients in other areas of the hospital.
That totally makes sense. So what would be the ideal setup then, the most effective way to organize this kind of service?
Well, the sources seem to suggest that the most effective model is really an independent hyperbaric medicine service.
Like its own department.
Exactly. A dedicated department that any physician in the hospital could easily refer to. And crucially, it could also accept referrals from outside the hospital. This kind of independent structure helps break down those departmental silos and allows for a much wider application of HBO therapy.
Okay, so if we picture hyperbaric medicine evolving into its own recognized specialty, what kind of training path would doctors actually need? Because right now it sounds like a lot of it is learned sort of on the job.
That's largely true. Currently, many physicians practicing hyperbaric medicine have mostly taught themselves or gained experience through preceptorships or mentorships. There just aren't many formal residency programs, specifically in hyperbaric medicine in the U.S.
Though you mentioned some in Europe.
Yeah, our sources mention some longer, maybe 4-year diving medicine programs in Europe that do fold in hyperbaric medicine training, and there have been some fellowships available in the States at times.
But if it were to become a full specialty, what would that ideal structured training path look like? What are the proposals?
According to the information we've got, a formal training program would likely require, completing medical school first, obviously, and then undergoing 2 years of general graduate training in either internal medicine or general surgery.
Okay, so a solid foundation first.
Right. And there might be some exceptions, perhaps for those who are already highly specialized or who have a significant amount of experience in general practice.
And how long would this dedicated hyperbaric medicine training program itself actually last?
The proposal seems to be for a program lasting at least 3 years.
3 years. Okay.
The first year would really focus on laying the groundwork, the basic sciences and research. This would involve things like working on an HBO research project, maybe animal or clinical.
Hands-on research.
Yeah, plus detailed instruction in the relevant physiology, how the body works under pressure with extra oxygen. And they'd also need to thoroughly study hyperbaric technology itself, how the chambers work, the safety systems, all of that.
Makes sense. Understanding the tools.
And it's worth noting that individuals who already have extensive research experience might be able to get an exemption from this initial research year.
Right, you wouldn't want someone who's already deep into research to just repeat that. So what about the other 2 years? That must be the clinical side, the hands-on experience.
Absolutely. Years 2 and 3 would be a clinical residency spent working in a recognized hyperbaric center.
A dedicated center.
Yes.
Yeah.
And to provide maybe a broader range of experience, this training could potentially even be split between 2 affiliated centers.
Oh, interesting.
Our sources also suggest that experience in, say, private practice settings could complement the university hospital training just to ensure a well-rounded exposure to both the acute cases and the more chronic conditions that benefit from HBO.
And for doctors who want to go even further, maybe specialize within hyperbaric medicine or aim for an academic career?
Yeah, there's the idea of an optional 1-year fellowship after the residency.
Okay.
This would allow for more advanced training in specific areas like neurological rehabilitation, maybe burn care, managing severe decompression sickness cases, or even more intensive research for those really aiming for academic positions.
So after all that pretty rigorous training, how would a physician actually get certified? What's the final step?
Well, there would be a series of examinations administered by specialty boards at the end of the training program.
Like other specialties.
Exactly. These would likely include a written exam to test their fundamental knowledge, the theory, but also, crucially, an oral or practical examination.
Ah, the practical part.
Yes, and our sources really emphasize that this oral component would be a very important factor in deciding if a candidate gets their certification.
That makes perfect sense. You really need to see how someone thinks on their feet and applies knowledge in, real clinical situations.
Rush.
What about doctors who are already board certified in other fields, maybe internal medicine or general surgery? Is there a faster track for them?
Yes, for those individuals, the proposed training could potentially be shorter. Maybe just 2 years, 1 year focusing on the core basics and theory, and then 1 year of dedicated clinical training in hyperbaric medicine.
Okay, a bit more streamlined.
And interestingly, those who already have significant hands-on experience in hyperbaric medicine might even be eligible to sit for their board exams after completing just 1 year of a fellowship program.
It really sounds like the overarching goal here is to establish a truly robust and standardized system for training future hyperbaric specialists.
Precisely. The emphasis is definitely on conducting this training within approved centers, centers that have a limited number of trainees at any one time.
To maintain quality.
Exactly. To ensure a really high caliber of specialists who are well equipped to push the field forward, both through clinical practice and through research.
Now, our sources also brought up something about a diploma course in hyperbaric and diving medicine. How does that fit in with these longer specialization pathways we've been talking about?
Yeah, the diploma course seems envisioned as a more flexible option. It might offer adjustable modules and durations, potentially ranging from, say, 6 months up to 3 years.
More adaptable.
Right. This flexibility could be really beneficial for people with different levels of prior experience, or maybe for those who aren't necessarily seeking full specialty board certification, but still need solid, in-depth knowledge in the area.
And what kind of subjects would a course like that cover? Is it similar content?
It would certainly cover the foundational sciences, things like the history of it all, the physics of gases under pressure, oxygen biochemistry and physiology, molecular
The
biology,
core science?
definitely. And also the physiology of hyperbaric, that's low pressure and high altitude environments,
Yep.
the mechanisms of hypoxia, oxygen toxicity, free radicals, diving physiology, compression, decompression.
Wow, quite a list.
Yeah, exercise under hyperbaric conditions too, the basic rationale for HBO, research methods, even things like bioinformatics and statistics for analyzing data.
That's a really comprehensive science base. What of the practical side, the technology?
There would also be modules specifically on hyperbaric technologies, so
Yeah.
covering the basic construction of chambers, the actual practical operation of different types of chambers.
Hands-on stuff.
Yes, practicals on operating chambers and using monitoring equipment inside them. Also important things like administering anesthesia safely in hyperbaric environments, general safety protocols, diving equipment, and other relevant tech for diving medicine.
And you mentioned optional courses too.
Yeah, interestingly, there's potential for optional courses looking into the economics and even the ethical considerations within hyperbaric and diving medicine.
It's not just the doctors who are crucial in this field, though, is it? I mean, the nurses and technicians working directly with patients and the equipment, they seem absolutely vital.
Oh, absolutely essential. The day-to-day running of the hyperbaric chambers and the direct care of patients getting HBO therapy, that largely falls to specially trained nurses and technicians.
So they need specific training, too.
Definitely. It's therefore really essential that they also get thorough education in the fundamentals of hyperbaric medicine and the relevant physiology so they understand what's happening.
And are there established training pathways and maybe certifications for these professionals as well?
Yes, there are a number of dedicated courses available specifically for hyperbaric technicians. In the U.S., for example, the National Board of Diving and Hyperbaric Medical Technology, they play a key role by approving these training programs.
Okay, so there's an oversight board.
Right. And the typical path to becoming a certified hyperbaric technician usually involves completing one of these formal training programs, then undergoing a defined period of supervised practical experience, a preceptorship, and then successfully passing a certification exam.
So once everyone's properly trained, doctors, nurses, techs, what does the actual practice of hyperbaric medicine look like day to day? Where should these specialized facilities ideally be located?
Well, the consensus from the sources we looked at is that the practice really should be based within a hospital setting, or at least have a very formal affiliation with a hospital.
Why is that so important?
It primarily ensures that patients have access to a wider range of medical expertise and all the necessary resources if, complications arise or if their underlying conditions need multidisciplinary care, which they often do.
Okay, that makes sense. And how might a hospital actually go about setting up a comprehensive hyperbaric medicine program? What are the key steps involved in getting something like that off the ground?
Our sources lay out a pretty practical development plan. It would usually start with preliminary meetings, bringing together all the key players.
Who would that be?
Well, maybe local physicians already doing some hyperbaric work, heads of relevant hospital departments, hospital administrators, maybe even people from insurance companies. And often, bringing in an external expert in hyperbaric medicine to provide some guidance based on their experience.
Getting that initial buy-in and support from everyone involved sounds absolutely critical, doesn't it?
It really is. For the program to succeed, you need that early support. After those initial talks and gathering support, the program details would be hammered out and a launch date set.
Then the announcement.
Exactly. A formal announcement to the hospital staff and the wider medical community is essential. This could involve things like educational lectures by hyperbaric experts, maybe an open house event so the hospital's medical staff can actually see the facility and understand the potential benefits for their own patients.
Good communication and just general awareness seem really important for a program like this to actually thrive.
Oh, absolutely. Generating some positive media coverage, maybe through local newspapers or TV, can be super helpful in raising awareness in the broader community that this treatment is available.
And outreach materials.
Yeah, creating and distributing informative brochures, maybe regular newsletters, can keep referring physicians and the public updated on the program's progress, maybe highlight some interesting cases. Offering regular tours of the facility for interested groups, medical professionals, potential patients that can also be a very effective way to build understanding and trust.
And of course, Actively reaching out to other doctors and specialists in the region seems vital for building that referral network, I'd imagine.
Exactly. The physicians working at the hyperbaric facility should be actively participating in relevant medical meetings nearby, presenting interesting cases, sharing any research findings they have.
Publishing, too.
Yeah. Publishing in peer-reviewed medical journals is also essential, yes. It establishes the program's credibility and adds to the broader knowledge base. And as we touched on earlier, the program itself should also make it a priority to offer really comprehensive training courses for the nurses and technicians who are going to be so integral to the daily operations.
Which specific medical specialties inside a hospital are most likely to send their patients for hyperbaric oxygen therapy? Are there particular types of conditions that pop up frequently?
Yeah, there are some key specialties that frequently refer. Orthopedic surgery is a big one, especially for complex bone infections, osteomyelitis.
Okay.
Oral and maxillofacial surgery, often for bone healing issues after procedures or radiation. Radiation oncology itself, particularly for managing radiation injuries to tissues. Osteoradionecrosis.
Ah, all right.
Plastic surgery for help with wound healing, skin grafts. Infectious diseases for certain severe infections like gas gangrene. And emergency medicine, especially for carbon monoxide poisoning or decompression sickness.
It's interesting, though, to think about how the actual practice might differ depending on where you are in the world, influenced by different factors.
Indeed. The way hyperbaric medicine is practiced in different countries, it's often shaped by local socioeconomic factors, the structure of the healthcare system, even cultural attitudes towards, adjunctive therapies.
And the approved uses vary, too.
Yeah, even the specific medical conditions for which HBO is routinely used can vary quite significantly. Our sources point out that the Undersea and Hyperbaric Medical Society in the USA, the UHMS, maintains a particularly rigorous and some might say somewhat limited list of approved indications for HBO therapy compared to other places.
Which naturally brings us around to the economics of it all. Cost is just such a huge factor in healthcare today, isn't it?
Absolutely, unavoidable.
Yeah.
The cost-effectiveness of using HBO has become an increasingly critical factor in whether the therapy gets approved and reimbursed, especially in the U.S.
So studies look at cost now.
Oh, yes. Many clinical studies now specifically include an analysis of the cost-effectiveness of HBO compared to other treatment options. Our sources highlight several conditions where HBO has actually shown significant cost-effectiveness.
Such as?
Things like chronic non-healing wounds, chronic osteomyelitis, that bone infection, again, osteoradionecrosis, burns, gas gangrene, and diabetic foot ulcers.
And why is it cost-effective in those cases? What's the main driver of savings?
Well, several factors contribute. In many situations, HBO therapy can significantly shorten hospital stays for patients with these conditions.
Which saves money directly.
Right. Lower overall healthcare costs. Additionally, in certain cases, HBO can actually help avoid the need for more invasive and expensive surgical procedures.
Like amputations, maybe?
Potentially, yes.
Right.
Which further reduces expenses and also the risks and potential complications that come with major surgery.
So even though the initial cost of buying and installing a hyperbaric chamber might be pretty substantial?
That's a fair point. The initial capital investment for the specialized equipment, it can definitely be significant, big ticket item.
Yeah.
However, the ongoing operational costs, they can be managed relatively efficiently, especially if the facility has a well-utilized multi-place chamber.
Treating multiple patients at once.
Exactly. For non-acute cases, that makes a big difference to the running costs per patient.
But there can still be hurdles getting insurance to cover it, right? That seems like a common theme.
That definitely remains a significant challenge for many patients and providers. Insurance companies might sometimes refuse to authorize or pay for HBO treatments if the specific reason, the indication, isn't yet widely recognized within mainstream medicine, or if they just perceive the cost to be too high compared to the benefit they see.
So more evidence is needed.
It really underscores the critical importance of doing more robust research and clearly demonstrating both the clinical effectiveness and the economic value of HBO therapy, especially for a wider range of conditions.
Okay, so pulling all this information together, what's the kind of overall current status of hyperbaric oxygen therapy within medicine right now? Where does it actually stand?
I think the key takeaway for you is that while HBO is definitely a recognized and valuable treatment for a specific list of disorders, its potential role in many other conditions is still being actively investigated.
So it's still experimental or controversial in some areas.
Exactly, or sometimes just not yet well understood by the broader medical profession.
And what are those primary conditions where it's really considered a first-line standard treatment?
The main ones where HBO is seen as a primary therapy are definitely decompression sickness, the Benz arterial gas embolism, which is air bubbles in the bloodstream, and carbon monoxide poisoning.
Okay, those are the big three.
Pretty much. In the vast majority of other conditions where HBO is used, it's generally considered an adjunctive therapy.
Meaning it's used alongside other treatments.
Exactly. Used in combination with standard medical or surgical treatments to try and enhance the overall outcome, not usually as the sole treatment.
But there's a strong scientific reason, a rationale for exploring its use more widely, isn't there? Based on the oxygen aspect.
Absolutely. There's a compelling scientific basis for using HBO in disorders where tissue hypoxia, basically, a significant lack of oxygen getting to the body's tissues, plays a critical role in the disease process itself.
Makes sense. Give the tissues the oxygen they're lacking.
Right. And despite the fact that large-scale controlled clinical trials might still be lacking in some of these areas, the clinical results that have been observed in many of these indications, well, they've been quite encouraging and certainly seem to warrant more investigation.
It really sounds like HBO is a genuinely powerful therapeutic tool, but maybe its full potential just hasn't been completely realized or widely accepted by everyone in mainstream medicine yet.
You could almost think of HBO like a pharmacological agent, like a drug, really.
Yeah.
It exerts specific physiological effects on the body, both when healthy and during disease states.
Okay, like a drug with specific effects.
Yeah, it has a defined range of effectiveness that varies depending on the condition being treated. And actually, it has a surprisingly long list of potential applications or indications.
But it's not a cure-all.
Oh, definitely not a panacea. And just like any potent medication, HBO also has specific contraindications, reasons not to use it, and the potential for adverse or even toxic effects if it's not administered correctly by trained personnel.
And you mentioned earlier that there seems to be this noticeable difference between the sort of conservative view of HBO's applications in the US compared to how it's being explored more broadly elsewhere.
That's a really crucial observation, yeah. In contrast to that relatively restricted list of conditions recommended by the UHMS in the USA, the sources we've been digging into highlight the application of HBO in a much wider array of disorders,
Yeah.
affecting nearly all systems of the body.
But not all officially recognized uses.
Correct. It's important to stress that less than half of these broader uses currently have that widespread official recognition. The others are still largely considered to be in the experimental or investigational stages.
Interesting.
And what's also interesting is that a significant chunk of this broader application seems to focus on disorders affecting the central nervous system and the rehabilitation of patients with those conditions.
Okay, so to sort of bring our deep dive here to a close, it really feels like hyperbaric medicine is at a fascinating, maybe even pivotal point in its development right now.
I think that's a great way to put it, exactly.
Yeah.
While it certainly made significant progress and is an established, valuable treatment for some specific conditions, hyperbaric medicine is still actively navigating its path towards getting that full recognition as a distinct medical specialty.
And the key is ongoing development.
Yeah, the ongoing development of dedicated, standardized training programs like we discussed, along with continued high-quality research to really validate its effectiveness across a broader range of conditions. Those are the crucial steps in its evolution.
Which leads us to a final thought for you, the listener, to consider. Given this growing body of evidence suggesting the therapeutic benefits of hyperbaric medicine in such a diverse range of conditions, what might be the far-reaching implications for doctors, for nurses, but most importantly for patient care worldwide if it does achieve broader recognition and more standardized training in the coming years?
Yeah. And what exciting new avenues of medical research might be unlocked with increased specialization and focus in this really quite intriguing field.
Definitely something to think about.